Dr. Unwin is getting his bi-weekly COVID test.
We're testing today. You can either be tested on a Monday or a Tuesday morning. The lab arranged to collect them. They do everything for us. And we get the results within 2 hours.
Almost by definition, him and his colleagues are working with poorly and vulnerable people.
Nobody wants to infect anybody with a virus that could potentially kill them. I mean, the only way for us to know if we're a danger to our patients in terms of spreading the virus is by having testing. It's as simple as that.
This kind of service is the exception, though. Asymptomatic NHS workers generally don't get tested, and most GP surgeries don't get this kind of service either.
Does it surprise you that we're now a month into the lockdown and that GP surgeries aren't routinely being tested?
It's preposterous. It's unbelievable that we're in this position of not being able to test and know more about this disease. I don't know why that is. We've all thought about it, we've all debated it, and we can't understand how we've got to this stage.
Dr. Unwin's swab goes here. It's a local PCR lab, part of a network of labs around the county trying to ramp up testing.
We are covering about 15 to 18 different surgeries across South Oxfordshire at the moment, and to date we've tested about 450 different personnel, all healthcare workers, frontline healthcare workers, and we have found to date 3 different healthcare workers who were completely asymptomatic and were unaware of the fact that they were infected. And one of those instances, the healthcare worker was actually working in a ward full of very highly vulnerable individuals.
But here's the catch. This is being funded privately. The government hasn't commissioned it or funded it, and the network is still waiting for accreditation. The question is this the kind of capacity that the government could, perhaps should, be tapping into?
What's happening in this lab in South Oxfordshire is what the government wants to happen across the UK. They're testing in surgeries, in healthcare centres, and they've even started testing in care homes. The problem is the government simply doesn't have enough tests to do this across the country.
The British government has had lofty ambitions on testing.
We're going up from 5,000 to 10,000 to 250,000 a day.
But after criticism that the UK hadn't tested enough, Matt Hancock declared that the government would hit 100,000 tests by the end of April, or in 9 days' time. The Health Secretary set up 2 core ways in which that target would be met. The first, to scale up swab testing in NHS labs and hospitals. The target for that was 25,000 a day in England by the end of the month. The second was to deliver increased commercial swab testing for critical key workers in the NHS and across the UK. By any calculation then, getting to 100,000 tests relies on non-NHS capacity from commercial, university and third sector labs. The Francis Crick Institute compares this kind of capacity to Dunkirk.
The small ships analogy is equivalent to the small research labs across the country getting together, bringing together their expertise, their infrastructure, their lab gear, their kit, their reagents, the machines, the complex molecular biological machinery you need to run these assays. And with their expertise, help local hospitals provide the testing that they need.
Yesterday's figures, though, suggest that that testing capability simply isn't being met. Yesterday, the government carried out 18,206 tests, way off their 100,000 target. Of these, only 2,407 were from outside the NHS or Public Health England labs. But the government says it's on course to meet its target and has brought in Roche, a huge diagnostics company. Even so, with 9 days to go, it's still 82,000 tests short.
My impression is there was very little evidence to that figure. It was simply plugged out the air. I don't think there was ever any scientific basis to this target. I don't think there was ever any other number crunching done.
The government says that although testing has flatlined, capacity is up. That although 18,000 people were tested yesterday, nearly 40,000 people could have, in theory. So why is testing not going up? One of the issues we heard is that not everyone finds it easy to get to centralised testing centres, and there are other reasons too.
I think it's because the criteria for testing are still too strict. For instance, Right now, in the healthcare worker setting, symptoms are required before a healthcare worker can obtain access to testing routinely. We are not routinely screening asymptomatic healthcare worker staff or asymptomatic people in the community or asymptomatic key workers.
Back in Oxfordshire, that asymptomatic testing is already happening. Mike Fisher, who owns the SBL lab, has funded a network of labs and says that they can do much more.
How quickly could you go from 0 to 10,000?
Well, as a network, we hope to be around 10,000 as capacity towards the end of April. We're doing 1,500 now, and our lab is at the smaller end, partly because of the way we do the test.
So in a week or a week and a half, you're saying, you could get up to 10,000?
We could get up to 10,000.
At the moment, however, this network exists without government backing. Mike believes it's the kind of small ship that the government should be doing more to support to get out of this lockdown.
I would say if there's one lesson that's very clear for all governments so far, is that unless you are very, very prepared, which few governments were, you don't want to just be putting all of your eggs in one basket.
A return to normality means testing. Dr. Unwin's surgery is open partly because they know the staff here are safe to work. To copy this up and down the country, though, will take an awful lot more tests.